Online, there are many accounts of hospitals in Metro Manila being filled to the brim as COVID-19 cases continue to rise. Some even tell tales of hospital hopping just to get much-needed care. But data from the health department says there might still be some room. 70% of isolation beds and 80% of ICU beds in Metro Manila have been occupied in the past 24 hours. The Octa Research Group noted that the agency's hospitalization data does not seem to match with on-ground accounts of health workers.
So there are still supposed to be beds available for patients, but from the ground, I hear from doctors who work with us and from my sisters who are doctors also that their hospitals are basically.
But there might be a different explanation for the seeming lack in hospital spaces. The Philippine Hospital Association admits some facilities think twice about admitting COVID patients due to a PhilHealth memorandum. Speaking on One News' The Chiefs, PHA President Dr. Jaime Almores said a circular 2020-0009 limits hospitals from collecting copayment claims from COVID patients.
Binawalan pa yung mga hospital na mag-collect ng excess or balance or what we call out-of-pocket or copay. Pero hindi mo pwedeng gawin yan sa private dahil pinagagalingan ng income ng private doon sa pasyente mismo.
Copay refers to a flat fee or predetermined rate paid by the PhilHealth member from their own pockets. This is in excess of what PhilHealth will shoulder. This does not sit well with the Private Hospitals Association.
What will we do if, let's say, the patient will not pay the excess? If the hospital will shoulder all the other expenses, then probably in a few days, all the resources of the hospital will be used up. And so the hospital will eventually stop operating.
As for the payment of other hospital claims, PhilHealth earlier said there have only been minimal delays. They said they're open to dialogue with private hospitals on claims that remain unsettled.
Insofar as turnaround time is concerned, we are not that delayed insofar as payment is concerned.
Spokesman Ray Balenya said the insurer is also in talks with hospitals on the around 5.6 billion pesos worth of returned or denied claims. Jovi Francisco, we are One News.